So what we're doing right now to determine the incidence in dogs is we're enrolling dogs with cardiac disease or proteinuria prospectively. Thus far, we have 6 groups, and we are dividing dogs based on their heart failure, renal, and treatment status, and we're measuring their urine aldosterone creatinine ratio. So if we are looking at dogs that are on an ACE inhibitor, if we get a value greater than 0.54 micrograms per gram, we interpret this as evidence of aldosterone breakthrough. We do have some patients that are not yet on an ACE inhibitor, and if their urine aldosterone creatinine ratio is greater than 0.54 micrograms per gram, we consider that to indicate RAS activation. Here are our groupings. We have patients in Group A, which are acute congestive heart failure. So these are dogs that have not seen any drugs yet for their heart failure. Group B consists of dogs with congestive heart failure that have had less than 2 weeks of standard therapy. And we define standard therapy as ACE inhibitor, furosemide, pimobendan, plus or minus digoxin, but not spironolactone. Dogs in Group C consist of patients that have had chronic congestive heart failure and have been receiving greater than 2 weeks of this standard therapy. We've separated out dogs that are receiving spironolactone in Group D. So these are chronic heart failure patients getting standard therapy plus spironolactone. And spironolactone may eventually become part of standard therapy. So finally, for our heart failure and heart disease patients, we have a group of asymptomatic patients that have either mitral valve regurgitation or other acquired cardiac diseases or congenital diseases. And last but not least is our proteinuric group. And this proteinuric study is just getting started, and we are not going to present the data from that today.